Okay, we're going to go ahead and get started. If other people join, they will just have to catch this presentation mid-presentation. My name is Michelle Sarju, and I am the program manager for the community-based parenting, peer support, and information for caregivers strategy of Best Starts for Kids. In the room, I have my colleagues, Sarah J., who is with evaluation and will be presenting later on in this presentation. And I have my colleague, Isabel, who is helping us with the technology and communications. A couple of things before I get started with the presentation. I unfortunately have a really bad cold and I'm prone to coughing, so occasionally you might see me take a drink of my water, or I'm looking for my cough drops right now, which I cannot find. Are they there? There they are. So now I have my cough drops, so I shouldn't need to lean forward and go out of your view. But I will do my best to get through this without coughing too badly. I'm going to be the facilitator for this webinar. This webinar is a little different than other webinars you may have participated in. I'm going to be covering 2 RFPs. And what's going to happen is I'm going to just go through both RFPs, the prenatal support services, the breastfeeding peer counseling services. Then there will be a data presentation. Then I will cover some general BSK information. And then at the end, we will have a question and answer period. What I'm going to ask you to do is, if questions come up during the course of the presentation, I'm going to ask you to write them down and hold them to the end. Because this is a presentation of 2 RFPs and we only have an hour and a half, I want to make sure that we're able to get through all of the information. As you can see, we have an agenda, and at a high level, what you can expect is an overview where this work fits into the overall Best Starts for Kids strategy. I'll talk a little bit about the county's work from an equity and social justice lens. And then I'm going to provide an overview of these 2 RFPs. So I'm going to start with the prenatal support services RFP. I will then talk about the breastfeeding peer counseling services RFP. Then there will be a data presentation, then general BSK information, and then questions. Okay, so the way this presentation is happening is we are using Skype, Skype for Business. We will open up for those of you who are not on Skype during the question and answer session. Right now you are currently muted. We will unmute you. And then if you are so inclined, you can also tweet. I think that's what you call it. I almost called it. I was also getting ready to say you can also Twitter, but that's probably not the right language. We are recording this presentation, so if you have colleagues, or if you have colleagues in your organization or from outside of your organization that would like to view this webinar, you will be able to view it in a couple of days. There will be a link on the Best Starts for Kids blog. Okay, so we can advance the slides. So the vision for BSK is a pretty simple vision, yet it's also the most comprehensive approach to child development in the nation. What we hope is that more babies are born healthy, more kids thrive, and thus leading to young people growing up to be happy, successful, contributing adults in our county. How we are doing this work is through 4 different, we're doing this work in 4 different ways. We have promotion. So when you think about promotion, what we want to do is increase the positive things that are good for families. So that's positive relationships, positive opportunities. This work is also about prevention. So we, through our work, are trying to prevent things like chronic and toxic stress, unsafe environments, or insufficient resources and opportunities. Then we have an early intervention strategy, which essentially means that for families who, let's say, for example, move to the county and they have young children, 0 to 5, they may have children who have challenges, or they themselves may have challenges. So our goal is to intervene early. An example of this is what we know through research is that for children who have developmental challenges, when we catch them early, many of those challenges can often be rectified so that by the time the child enters school, they are on par and ready to perform at the same level of their peers. And then we have policy and systems change. This work cannot be done without this piece. Direct services are crucial, and there needs to be a systems-wide coordination so that the whole child can be served. So a piece of this work is policy and systems change. In terms of how the Best Starts for Kids funds are allocated, 50% goes to investing early, that's the prenatal to 5. 35% is allocated to what is called Sustain the Gain. That's our 5 to 24 bucket of work. And then we have 5% of our levy investments dedicated to data and valuation, which is really important. This is a voter-approved levy, and we want to be able to demonstrate to the generous voters of King County that their investment, i.e. Increase in property taxes, is actually working for the positive, in hopes, of course, of having this levy renewed in 6 years. And then we have a portion of the funds, 10%, going to our Healthy Communities work, which happens through our Communities of Opportunity and the Seattle Foundation partnership. In terms of equity and social justice, we recognize here at the county that there are persistent inequities that exist, particularly by race and place. And that in many cases, in some communities, things are getting worse and collecting and threatening the collective prosperity of the families across our county. What we recognize related to race is that racial disparities and disproportionality exist due to historical, structural, and in many cases, intentional policy making that have excluded people of color from opportunities. For example, such as education, the opportunity to earn living wage and save for retirement. We also recognize that without a conscious effort to change the way things are done, government policies actually can have the unintended impact of perpetuating these inequities. What we mean by place is where you live. There is a plethora of data that actually says your zip code matters and that your zip code can have a direct impact on your health and access to resources and opportunities. King County is a very geographically diverse place, and we recognize that there are urban and suburban and rural areas that are underserved, and that in those places, there exist pockets of need that people perceive. Exist pockets of need in those areas. And so as part of this work, we are trying to ensure that we reach those places. Okay, so this particular strategy, these two RFPs, are housed in what's called the Community-Based Parenting, Peer Support, and Information for Caregivers strategy of BSK. To date, I have released 3 RFPs, Basic Needs, Kaleidoscope Play and Learn. There's a typo on this, which I will fix before we upload it. Kaleidoscope Play and Learn, there recently was a Parenting Caregiver Information and Support RFP that has closed, and the grantees are announced on the Best Starts for Kids website, should you see that. And then this particular presentation is about hopefully my last two RFPs, which are prenatal support services and breastfeeding peer counseling services. Okay, so as I said earlier, I'm going to start with talking about the prenatal support services. So the purpose of this particular work is to promote community-centered services that offer comprehensive, evidence-informed models of care that have demonstrated over time to yield improved prenatal birth and postpartum outcomes, all in the context of nurturing, in a nurturing, relationship-centered environment from preconception to postpartum. It is also, this particular bucket of work is designed to assure that parents preparing for pregnancy and childbirth can receive culturally relevant and culturally versatile support and education from their peers and professionals, hopefully in the communities where they live. The strategy for this particular RFP is a multi-system effort that is aimed at improving outcomes related to pregnancy and birth while focusing on health literacy and health equity strategies. Okay, now I need to take a drink of water. So some examples of what prenatal support services might look like, and I want to qualify this by saying these are examples. There are other examples that exist, but for the sake of time, I've just listed a couple here. So healthy pregnancy education, which could be in the form of childbirth classes, it could be in the form of support groups, preterm labor and preterm birth prevention strategies. This actually is a big piece of this bucket of work, because what we know is that babies who are born too early can often times have lifelong impacts that that can affect their abilities later on in life. And so we want to invest in strategies that will yield healthy pregnancies, as well as babies being born when they're ready to be born. Another example of work might include culturally relevant group prenatal care or prenatal classes. Within every BSK RFP strategy, we have what's called headline indicators and secondary indicators. Headline indicators are aspirational measures that help quantify BSK's three overarching results, and they will be used to align partners and investment strategies. Secondary indicators are those supporting indicators that describe sort of the status of our prenatal to 5 population, and we have data, but they actually don't arise to the top when we think about headline indicators. So as you can see on your screen, headline indicators for this particular strategy are preterm births, infant deaths, and children who are flourishing and resilient. And then the secondary indicators that we hope to see is that pregnant people have early and adequate prenatal care, that they have the family supports that they need to have healthy pregnancies and births, and then of course we want to see healthy children. With this particular, that says breastfeeding. My slides are out of order.
Can we just skip forward?
Let me see, actually. So as you can see, this is what happens when we do these. I realize where my mistakes are. Let's look here. I wonder if I just transpose the slides. Or I wonder if I replaced. Okay. Let me think about this. I will come back to the funding priorities. We'll do that. Because this particular RFP, so what you see now are general funding priorities, which are a part of almost every RFP. What I will do is when Sarah J is doing her data presentation, I will actually bring up the RFP that lives on the website and extract the funding priorities that are specific to the prenatal support services. But as you can see on your screen, our funding priorities with this particular strategy are to invest in organizations that are embedded, particularly in communities of color, immigrant and refugee communities, low-income communities, communities that have disabilities or developmental challenges, and then limited and English-speaking communities. Sometimes people ask why we name these specific things. Traditionally, the way that funding has worked, both on a local and national level, is that oftentimes community-based organizations are not eligible for funding for a variety of reasons, which include the need to actually implement programs that are culturally relevant, which aren't necessarily evidence-based. So this particular work aims to get at that disparity that has existed for a very long time across funding strategies. You go ahead and advance it. Okay. With this particular RFP, what you can see is the total dollars available, and it is up to the amounts. The award will depend on what you request and how that relates to your budget. And so I would encourage you to ensure that when you develop a budget, that it's realistic and that costs actually match program design. All right, so now I'm going to move on to the breastfeeding peer counseling services. And what I may need you to do is, you know what, I won't need you to do that. I'll just get the handout and go back to the funding priorities because now I have it. Okay, so for the breastfeeding peer counseling services RFP, this is another topic-specific RFP, and the purpose is to provide culturally relevant peer-to-peer breastfeeding support. It's also designed to support parents to initiate and sustain breastfeeding through an infant's first year of life, to have the flexibility to offer education and support in a variety of settings such as community health centers and clinics, possibly through home visits, or at prenatal clinics and birth centers. It is also to be able to provide home visits for breastfeeding support when necessary. And then this is a pretty unique component, and that is to provide free international board certified lactation consultant, that's redundant, services to marginalized families. I've been doing prenatal and breastfeeding work for over 25 years now, and there really doesn't exist a large-scale opportunity for low-income people to access lactation consultant services. And so part of your proposal should have a generous and reasonable amount to actually compensate a lactation consultant to provide services to marginalized families. Some examples of how this work might look: culturally relevant and linguistically accessible breastfeeding education and or support groups. This is really, really important. Out in the community, there are groups that that are available, but they're not necessarily culturally relevant or language specific. The other piece of this work will include home visits when families have challenging breastfeeding problems, and then again, lactation consultant home visits. As you see here, these are the indicators for this particular RFP, which is healthy babies, children who are flourishing and resilient, and then breastfeeding exclusivity, parental connection and support, and parent attachment for the secondary indicator. Okay, so I may need, let me look. Does it look like, okay, so after this slide, I'm going to go back. I'm going to pause, and then I'm going to go back to the, will you be able to bring that up?
Back to the funny
Yeah.
stories?
Okay. So as you can see, this is the, this slide contains the amount of funding. Again, it's up to your budget should actually reasonably match your program design. Okay, I'm going to have you go back to the, okay, so as you can see here, the funding priority for this particular strategy is to provide peer breastfeeding support services and a higher level of support when needed to specifically the three communities listed: the African American, Native American, Pacific Islander, as well as geographically rural and low-income communities and families. So this is called out, and Sarah J., my evaluation colleague, may actually be able to bring up some information regarding this, but the data is really clear that these three communities, their levels of breastfeeding statistics are not the same, essentially, or close to the same as Caucasian American community. And so through this data, we made a decision to focus on these three communities. Now, that does not mean that no other community could be served. What it means is we're going to prioritize these communities. Okay.
This one?
No, you can go through that. I don't want to read the slide. They can see that. So you can go to the next one. Okay, so as with all other RFP strategies, the way this process works is once the RFP closes, all eligible proposals will be reviewed and scored by a panel of community members, subject matter experts, and King County staff. We do this so that we have a diverse group of people who can provide input and guidance on who should be selected as a grantee. With any process, the county has a process for appealing decisions that have been made, and the full RFP is on the Zoom Grants website, and so you should see that RFP for information. Okay, at this point, I'm going to move. Oh, we're going to stay? Will they be able to hear you?
Yeah.
Okay, all right. So I'm not going to move, but my colleague, Sarah J., is going to do the data and evaluation presentation.
Thank you, Michelle. If you have any trouble hearing me, please do type a note to us in the chat box so that we can try to improve the sound quality for you. I'm going to talk briefly about some ideas for using data in your proposal, as well as what you can expect from us around evaluation if you are funded. Our data and evaluation team here at Best Starts for Kids has 3 guiding principles, which we hope you'll see reflected in our work together, which are partnership, collaboration, and accessibility. When you think about putting together a proposal for one of these 2 RFPs, data can be a really compelling way to help reviewers understand the needs that you're addressing, the strengths of the communities that you're leveraging, and the ability of your organization or your program to make a change. But there's a ton of data out there, and I always like to say that whether you are a little data shy and intimidated by all that, or you love data and you can just go down the rabbit hole, there's so much out there that it makes more sense to think through what's the story that your proposal is trying to tell. and then what data will help you tell that story. And think through that a little bit, and then have an idea what you're looking for. Again, whether you feel intimidated by all that data or you just love it, you can sink a lot of time into looking at it. So think about what's the data that will help back up the story you're telling in your proposal. When you think about what counts as data, if you will, numbers are very often the first thing that pops into folks' minds, quantitative data. And obviously that can be really helpful, but it's not the only kind of data that is valued by Best Starts for Kids, or that will be compelling to the reviewers who look at these proposals. You can use maps or other images, and you can use quotes and stories as well. That can be considered a form of qualitative data. We always also want to remind you that if you use any stories or quotes from clients that you've served, please be sure that you do so in a way that respects their confidentiality and shares their story in a way that they're comfortable with. But keeping that in mind, that can be one of the most compelling ways to really help reviewers understand the work that you would like to do and the communities that you would like to serve through your proposal. It can also be really effective to pair multiple different types of data together. So maybe you find a number that's relevant to the need that you want to meet, the community that you want to serve, and maybe you have a quote or a story that really illuminates that data and shows what that number actually means in the community, and helps reviewers understand why what you would like to do is so important. So when we say using data to tell your story, we mean that really broadly, not just King County data and not just numerative data. There's a ton of different sources out there. Again, why we suggest thinking through what will be most helpful to you. And one thing that I am going to take a minute to share today is some of our King County data resources. As I mentioned, accessibility is one of our values, so we want to make sure that everyone who is interested in exploring this data knows that it is available, and a little bit about how to navigate it and how to find what you're looking for there. But you're certainly not at all required to use it. There will not be any preference given to proposals that use King County data. You should feel free to use whatever data sources are most helpful to you in telling the story of your proposal. That could be state or national data, especially for some communities that are hard to get local data on. That might be the best place for you to find information. And your organization, your program itself, is also probably a really rich source of data. You might have data that shows how your leadership reflects the communities that you serve, data that shows the successes of past programs that you have operated. So think broadly about where you might be able to find data, and keep in mind it really doesn't need to be data that we at King County provide. Another thing to keep in mind is that if you are struggling with finding data and you would like to find more data to include in your proposal, there is technical assistance available to all BSK RFP proposals. So definitely that is one thing that our technical assistance providers can help you with. Feel free to reach out to them if this is something that's challenging you. I'm going to take a moment now to show you our Best Starts for Kids indicators. We have some interactive visualizations. I think they're really cool because there's a ton of information that you can find there. They're not always intuitive to navigate, so I do like to take a minute to demonstrate that, so that if you are interested in exploring this data, hopefully you will feel a little bit more comfortable doing so on your own. So if you'll bear with me, I'm going to go to our Best Starts for Kids indicators website. These are all of the indicators that Michelle mentioned earlier. It certainly might not be the only data that you're interested in, but the interactive visualizations that you'll find on many of our King County resources work in similar ways. So by showing it to you here, hopefully it'll be familiar across multiple King County platforms. These are the big picture population level goals that Best Starts for Kids is hoping to reach. no one organization or program or strategy is held accountable to impacting these things for all King County families, but we are looking at them at that big picture level to see what kind of difference Best Starts for Kids may be making synergistically across all of our different partnerships. So let's take an example and look for some breastfeeding data here. I will give you one little tip, which is when you're searching, whatever you type into the search bar, it will search exactly that. So if I type in here breastfeeding, you'll see here that there's breastfed exclusively through 6 months, breastfed for at least 6 weeks, breastfeeding initiation. If I type breastfeeding, why is this not working? It will only search for exactly what you type in. So I think it might be a little bit more helpful to keep in mind, try typing something multiple different ways. So like obese and obesity. For breastfeeding, I'm gonna go ahead and just type in breast, and we'll see that that gets us all 3 of these different indicators. So let's take a look at who in King County, what babies were breastfed exclusively until 6 months of age, which is a common recommendation around breastfeeding. Here's those interactive visualizations that I was mentioning. This tells us that overall in 2017, 36% of King County children were breastfed exclusively. And on the map, we can see that there are some slight geographic differences. We have the East region, the North region, Seattle, and the South region. Now, a key thing that's easy to miss on these visits is that there are these different tabs at the top. And so demographics is where you can find information about a lot of different race and ethnicity and socio-demographic groups. This data comes from the Best Starts for Kids Health Survey. So in addition to having information for what are often considered the standard racial and ethnic groups, we have further information for more specific racial and ethnic groups as well. You'll see that some of these have this little caret instead of data. Unfortunately, when we have small numbers of responses, we don't have good solid estimates that we're confident in, although hopefully that will be changing as we gather more data through our second round of survey administration. The groups that you'll see vary depending on the data source, so it won't look exactly the same for all these different indicators where we're pulling together data from lots of different places, but overall what you'll see will work the same way. And you can see a list here. You can look at differences by household income, you can see differences by region, by language spoken at home, by the parent's age, and the parent's education level as well. So those are our interactive visualizations that you can use to check out our Best Starts for Kids indicator data, as well as a lot of our other community health indicator data. Another resource I want to point out is Communities Count. We have a page on here up at the top called Data Resources if you're looking for additional information. This is one place to check that might help you find additional information. There's also more information here that's not necessarily health specific, but about our economy and our population. So if you want to check out the population tab, that's a great place to look if you're looking for what is demographic information about King County. So where do people of different race and ethnic groups in King County live? What's the percent of people living in poverty in different parts of King County? All kinds of stuff like that are available on Communities Count. So those are some of the Best Starts for Kids resources. Again, you are not at all required to use them, but they are there if you are interested or curious. And I hope that taking a look at them today, you'll feel confident navigating them if you would like to do so. And again, do feel free to connect to a TA provider if you need support with that. So thinking ahead, switching gears a little bit to think about evaluation. All Best Starts for Kids programs, as Michelle explained, are going to be required to participate in evaluation. We will work together collaboratively with the funded programs to develop a performance measurement plan. So that means you do not need to submit an evaluation plan as part of your proposal. Not something you need to worry about at this point. You may want to include it in your budget. Often people include that in the staffing time, because it does take time to collect the data that we decide we want to collect and report it back. That might not be the only evaluation expense that you can envision, but do keep it in mind, and be sure to build it into your budget, because we want to support that part of the work as well. On the RFP, you'll also see a list of indicators. You're not going to be scored based on how many you check, so please think carefully about which you think are most directly connected to your program. And keep in mind, we do know that many programs have a lot of different reporting burdens to various funders. And so when we do work together with the funded group to develop our evaluation plan, we'll do our best to coordinate with other existing data collection that you're already doing, and not pile on something that's, you know, very similar but slightly different that you have to do all over again just for us. We hope to minimize that reporting burden for our partners. All right, so with that, I will hand it back to Michelle.
Okay, so before I go through the last part, I'm going to read from the RFP, the funding priorities specific to the prenatal support services RFP. So the prenatal support services RFP will prioritize a service focus on the African American, Native American, and Pacific Islander communities. So if my slides had been correct, which I somehow deleted them, they were correct at some point last night, and I'm not sure what I did late into the evening. It would have made sort of logical sense for the identified communities in the breastfeeding section. Generally, prenatal and birth outcomes, particularly adverse birth outcomes, will oftentimes lead to breastfeeding complications, which can impact whether moms choose to breastfeed or not, or how long they breastfeed. So again, while we're prioritizing these 3 communities, it doesn't mean that other communities can't be served. But it is important that in your application that you be able to demonstrate that you have the expertise and the capacity to serve these 3 communities. Okay, so now let me get back. Let me minimize this. Okay, so in terms of how we want you to be able to stay connected with us. So there are a number of ways where, again, we do Twitter. We have the Best Starts for Kids blog, which is actually a very important resource for you. So if you're not subscribed to it, I suggest you do that today. On occasion, if we have community events that you might be interested in, that would also be announced through the blog. And then again, you can email us at, where it is. Oh, there's our website, our blog, and Twitter. Thank you. I thought I was missing a slide. The county is actually providing technical assistance to all applicants. There's going to be a slide coming up soon, but it will list the providers, and they're also listed on the Best Starts for Kids website. Is that correct? Yeah, the Best Starts for Kids website. Those TA providers, you should see them momentarily. I'm done reading from the slides, which is why there was a delay. Again, this PowerPoint will be uploaded. It will have the corrections that it needs to have and any additions that it needs to have. So you can go to the TA providers. So there's a list. Again, those people can be found on our website. And at this point, I will take questions. So, okay, so we have a question. Are you going to be able to unmute people, or do I unmute people? Okay, so we have a question that actually came in through the chat box, so I'm going to read it. And If you are going to ask your question through your microphone, can I unmute them?
Yeah, you can.
Okay, you'll have to show me how to do that. Then what I would ask you to do is say your name and the organization that you're with. So first, I'm going to read the question that came through the chat box, and that is it possible to include pictures in the narrative we upload? If I recall correctly, the Zoom grant system doesn't allow for that in the text boxes. I believe you're correct, and when I say I believe, this is the first RFPs on the public health side to be released through Zoom grants. So I actually don't have an experience with people submitting things through Zoom grants. I don't have a previous experience. However, the system does allow for you to upload documents. And I don't remember what page it's on, but if you want to do attachments of documents, you could do it that way. Okay, so Isabel, can you show me how to unmute people? Where do I go up here? Oops.
Sorry.
Oh, that's okay. Let me move it because I was.
Okay, and then you have to.
Unmute
Well,
everybody.
people have to unmute themselves, but
Okay.
you can also just do that. You don't need to unmute me though.
Okay, so. One second. I'm unmuting the last person. Okay, you are now all unmuted.
I have a question.
Yes, and who's speaking?
This is a guy from Horn of Africa.
Uh-huh.
So how many organizations are going to be awarded?
One for each strategy.
Okay.
Yeah, thank you. You're speaking about a variety of communities. You also have spoken about equitable coverage. And so there are immigrants and refugees in this country, and they are probably the most needy. And do you have one organization that can serve all these diverse cultures, diverse linguistic categories?
I don't have one organization in mind, or otherwise I wouldn't need to release this RFP. That remains to be seen if there is an organization that has the capacity or already in existence, a staff representation that could serve different communities, both culturally and linguistically. So I don't have one organization in mind. Again, there would be no need for me to run an RFP if that were the case. The reason why it is one versus other RFPs where there have been multiple is because this is a small amount of money. There are some critical needs in the community. And this is neither one of these RFPs are to explore a new way of if an organization could do this work and how they might create a new program. Because the statistics are pretty alarming in terms of outcomes for the communities that I listed, we want the organization to actually be able to hit the ground running. And that means they do need to have had some kind of experience in providing work in these two areas before.
Yeah, okay, thank you. But you have not touched at the variety of cultures and the linguistic categories that exist. How do you expect this one organization to deal with all this? Or do you expect that some language groups may be excluded because of the limitation of outreach?
I think that so when we think about the priority communities that I listed in the RFP, those are the communities that actually have statistics that point to the need for a focused strategy. So it will inevitably mean there are 72 different languages spoken in the 98118 zip code in King County. There has yet to be any RFP. We are not serving 72 languages throughout the entire BSK strategy. I think as an initiative goes, the county is doing a really good job of serving a large number of languages, but it's not possible with even 2 or 3 RFPs to serve all 72 languages. And that statistic I just quoted, that was like a 5-year ago statistic. There could be even more languages at this point. So I do not expect that every language group in King County will be served through these RFPs. That's just not possible with the small amount of money. But what I do expect is that, and again, I don't make the decision of who gets awarded. It is a review panel that makes recommendations that get forwarded to leadership. And then the county council has the last say on who actually gets awarded. So this process is set up so that, for example, I might say, well, my favorite organization is Horn of Africa, which means that no one else will get funding if that were the case. So the process is set up and structured in such a way that I think it does yield a fair outcome. And I hope in most cases, if not all cases, the best organizations get selected. So that's a long way to answer your question. No, we will not be able to serve all languages. Even if we had 2 or 3 applicants, we still could not serve 72 languages with this strategy and the amount of money that we have.
Thank you.
You're welcome. Any other questions via the phone or the chat box?
Hi, Michelle.
Yes.
Hey, this is Tara, one of the midwives at the Rainier Valley Community Clinic.
Yes.
Lactation has been at the forefront of our hearts and our minds of what we've been doing at the clinic. And we have a lactation lounge drop-in group that we've been running with in partnership with Cami Goldhammer for the last almost 2 years now. And we're wondering if you're willing to consider our small, grassroots organization with experienced providers from the community, or are you looking more at the larger, well-established organizations?
Well, I'm not sure what you mean by the larger, well-established organizations. And I mean, you don't have to name that.
Okay.
I think inevitably, if you look at the RFP, and now just for the audience, we're specifically talking about the breastfeeding peer counseling RFP. There is a piece of what I recognize is that I made it a requirement that whatever organization is selected has to compensate a lactation consultant or consultants, an IBCLC certified lactation consultant. Because what I recognize from having done this work for a long time is, first of all, those services are very expensive and legitimately so. When I say expensive, I don't mean that the cost of that service is out of proportion to the benefit, but low-income breastfeeding people cannot afford a $150 an hour lactation consultant. And so any organization that applies for this has to have, I'm trying to think of a good descriptor. They have to include compensation for that, and the most competitive application, the compensation will be fair. Let's just put it that way.
Okay. Thank you.
You're welcome. I think the other thing, Tara, is to think about, it has been the case with many BSK strategies that there have been partnerships. And I think highly effective work gets done when there are partnership opportunities in the community. And so I think what you described is you have you provide a clinical service, and then there are organizations that don't do clinical services but provide direct support services. So maybe there's an opportunity for a partnership. So that's something to think about.
Okay.
I don't know who that might be for you.
So right now we are training with Cami. We've trained 5 lactation interns. We're hoping, so not only are we providing service to the families, but we're looking within the community to grow and train and have them become lactation specialists, or if we can get them to IBCLCs, that's a big part of providing the clinical hours for them to become IBCLCs through this training. And in the last 2 years, they're almost halfway through with the required clinical hours to become IBCLCs. So we're not only looking to help improve the outcomes of the community, but also to improve the capacity of more providers of color within the communities.
Yeah. Well, it sounds like, your organization may want to think about a partnership.
Okay.
I don't know if that's with Cami. I'm not making any suggestions.
Okay.
But based on what you said, your work is primarily clinical, and while you're training people, the direct service has to happen somewhere.
Yeah.
And maybe that's through your clinic. I don't know.
Okay. Yeah. Thank you,
You're
Michelle.
welcome. Any other questions?
Yeah, I have one question. Can I ask? This is from Horn of Africa Services again.
Yes.
This is with regard to data and evaluation, and we thank you for the information that you provided. But my question is, when we talk about performance measure, it's going to depend mostly on the objectives that we're going to develop. How many people are we going to reach out? What kind of service are we going to give? To what extent? What results do we expect? Those will be detailed on our, usually are they detailed in our objectives. And so what we would need to do, I think would be the best thing to do would be for any organization that is granted to develop proper objectives, and then to make sure that they are able to measure those objectives, because that's how they can really measure their performance. Because some of the data we're getting are, very generic, and we may not be able to impact them. I mean, some very generic data that's available in your system speaks about, larger community where each one of us are going to be working. Maybe the one that you are going to fund is going to be working with a limited number of people. So their performance is going to depend on those people that they are going to be serving. So Can we make sure that that is really clearly understood by the grantee, so that it could be whatever they do could be of we could learn from that. The important thing is here that we have somebody that is given this opportunity. This is very important. This mother and child health is very important. We've been working in Africa with the World Health Program for many years, and we have developed many good programs. That's how people survived, there would have been some villages would have been completely, eradicated. But World Health Program helped us. The training they provided, the consultation they provided helped. So there is some that lesson that we've learned, which is very important, and we would like that to be, sort of, propagated here among the several organizations that exist. So whatever results come from this initiative is going to be a learning, information for other organizations. So I really will be very grateful if we could make whatever results are obtained to show us how they were obtained and what were the impediments. Thank you.
Okay, so I think I'm going to try to sort of restate what I think the question is. So I think what I heard you say is how is the data going to be measured, and that it will be important for organizations as they develop. So I heard something about objectives, and I'm gonna let Sarah J take a stab at answering this question.
So I apologize, we couldn't hear all of your question perfectly clearly, so I'm not sure I got all the details of what you're asking, but let me provide some information, and then please do clarify if you have further questions. So with the proposal, you should have, some clear goals of what you want to accomplish in your program, I would imagine. But you don't need to worry about translating those into performance measurements. That's something that the funded programs, their staff, and Michelle here, and our data and evaluation team will all work together on once a grantee has been selected. To give you an idea of what those performance measurements look like, our general practice is we have 3 questions, and we come up with at least one measurement for each of these questions, which is how much did we do, how well did we do it, and is anyone better off? Those 3 questions come from results-based accountability, and examples of what could be measures for those. It's not to say what will be measures for these programs, because like I said, those will be worked on together. But how much did we do might be the number of people served. How well did we do might be something related to retention or getting, client survey feedback on whether, they thought the program was well done, that kind of thing. And then is anyone better off? You might, for example, have data about breastfeeding duration among families that are participating in your program. So those are just some examples of what we will be looking at in terms of when we think about developing those performance measures. Those are different from those big King County-wide indicators. As I mentioned, no single program is responsible for changing that for all of King County. It's something that Best Starts for Kids and many other programs and many other factors all impact. Another part of your question that I think I heard was kind of around capacity to gather and collect and analyze that data. Many organizations already have their own systems in place. You might want to change or improve that system, just depending on what you already have. Our evaluation team will work with you if we need. There have been a really wide variety of ways that people are reporting their data, either through pulling reports out from data systems that they already have. At its most basic, we would provide you a Excel spreadsheet to fill in for some programs, generally smaller programs than this, but that's an option. And then there's other things like REDCap that could be considered. So yes, definitely how to collect that data and making sure our partners have the capacity to do so is something that we're aware of, and that again will be figured out with the funded partner. It depends on what their existing data systems and capacity and preferences are.
That's exactly what I said, actually. Probably my sentence construction could have been different, but exactly that's what I said. But,
Okay.
we will need to show it in our objective. We will say we'll serve so many people, we'll have so many training programs, and we expect, regular attendance. We expect feedback from the participants. We will do tests. We will do focus groups. We will do all those things, and then from that we will be able to show, okay, how much did we do, how well did we do it, and then we will know. We will follow up and do as you said, we'll follow up with the participants and see how they are doing, and then that will tell us to what extent they have applied or to what extent they have applied the learning that they've gotten from us. So exactly,
Yes.
that is it. So
Yes.
that you're right, and I was comparing this to the the broad perspective of the data that is shown in the table. So I think we agree, really.
Yes. Thank you.
Thank you.
Yeah, and that is a expectation of any BSK grantee for any strategy. So it's a universal way of how we approach data and evaluation here at the county. Do we have any other questions from any other people on the phone? Well, somebody got a text message. So, if there are no other questions, I'm going to suggest that we end this particular webinar. There will be an information session, I believe it's next week, Thursday, at the Beacon Hill Library. It is in the RFP that's on the website. I will not be the one presenting, as I will be out of town, although I might be remotely on the phone to answer questions. It's going to cover essentially the exact same information. The PowerPoint will be updated at that point. If there are questions that you still have after ending this, you might want to consider attending that in person. But otherwise, there are ways for you to send your questions through Zoom grants, which get checked by a contracts person and get answered. They're not necessarily answered as they come in. Oftentimes what happens is a document with questions that have come in over time are posted, but we do get to answering people's questions. So if something comes up at a later date, you can feel free to send us a question.
Thank you. Thank you so much.
You're welcome. All right, with that, we are going to end this webinar, and thank you all again